every time we do it here at Children's. And if we don't get started on time, sometimes those folks at home get a little nervous. They're not quite sure if they've got the right connection or something. So we'll probably have a few people coming in after we get started. No big deal. I want to thank you all for coming to our Parenting You class tonight on surviving the trying twos. I have 2 children of my own. I remember this time. I just want to give you all a big hug and say, hang in there. You'll get through it, and you're going to get some great advice tonight. Before we get started, a couple housekeeping rules. If you have cell phones or pagers, turn them off or on vibrate. Restrooms are located right out the door and to your left. I will have trash cans outside the doors when you leave, so you can throw away your trash. And if you have questions, just jot them down on your handout. We will leave plenty of time for Q&A at the end of the presentation. So with that, our speaker tonight is Tony Yagmore. You guys are in for a great treat. He is a pediatrician with Children's Physicians. He practices at our Creighton office. He's a phenomenal pediatrician. He's a funny guy. And he is the parent of 6 of his own, one of which I believe is in their age. Yes. So yeah, you guys are, he knows what he's talking about. So with that, I'll turn things over to Dr. Yagmore.
So the pediatrician's kid does it, so it must be okay. So I hope you can relate to a lot of the stories I share about that. So on the top here, advanced training for the hardest job of your life. I didn't notice that on the slides. You know, I've kind of gone through these slides a little bit. Never noticed that. If you can remember back to your first child that was born and think about all the joy and emotion you had with that first child. And when I see those parents for the first time, I'm so excited for them. But I tell them one thing. I say, welcome to the toughest job you'll ever have. It is by far the toughest thing you'll ever do, and I can attest to that. Having that first child is the toughest thing you'll ever do. I've had twins. I've had 4 kids, 3 and under. I've gone through medical school and residency. My wife went through medical school and residency. I've gone on 3 hours of sleep for a week for 3 weeks. And it's still not tougher than having that first child, okay? And those that have twins as their first child, or triplets as their first child, or I don't know how you would do it. But with all that being said, the joy of doing it, if you can remember all the good times, and when they're grown up, the good times are what you're going to remember. It's not these frustrating moments. Am I moving around too much?
Nope.
Okay.
Do we have Rylan M?
Okay. Is it a toddler problem? Because we can talk about it when you come back if there's an issue with it. So, now I've lost my train of thought. I'm sorry. If you could, yeah, you'll remember the good times. You won't remember these. Oh my God, too. Until your grandparent and your child is going through that, the twos, then you'll remember back to those times. So anyway, so let us commence. Oh, here is my family. This is why I do what I do for my family. They're the world to me, and I have actually cut down on some of the work that I do and some of the talks that I give and some of the teaching that I do because I didn't want to miss them growing up, and I didn't want to look back on my job. For those mothers in the room, just a quote that I like to say. They asked women on their deathbed, what's the one thing you regret most? Men, it didn't work, but they asked women what the one thing they regret most in their lives, and by far the top answer was, I wish I would have had more children. So think about that. That was the biggest regret for women. And so for me, you're like, wow, he had 6. Well, I kept that in my mind, thinking, I don't want to regret that on my deathbed. So we kept going, and hopefully, I don't know, but I think we're done. I'm getting old. So anyway, so the first thing we're going to talk about is milestones. So we're going to kind of glaze over some things and hopefully hit some important topics that you guys want to talk about. So as far as physical milestones, Walking up and down stairs, that's our gross motor. And when you go to your doctor for the child, the family practitioner, the nurse practitioner, the pediatrician, they're going to ask you some of these questions. Does your child walk up and down stairs? And they should be able to do that independently. Even though sometimes you're scared when they're first doing it, oh my God, they're going to fall. This is something that eventually they will master slowly. Kick and throw a ball. It's very good to have, even if you're not sports related or anything, having a ball around for your kid to play with, the kick, the throw around. Hopefully it's a softball, something soft, not actually a soft ball, because that probably is not safe to do. But it's very good for them for their gross motor and some of the fine motor. Okay.
All right, next winner, Brooke R.
Okay, so they winning prizes or okay. Okay, jumping and climbing, even though we hate the fact that they climb everywhere and they can get to everything, it's actually a sign that your child's developing well. And one of the things I tell parents related to climbing is safety issues. If you put something somewhere around and you have a toddler, think to yourself, can my toddler get to that? And if they can, will it hurt them before you place it there? And when I say that is, toddlers move things to climb up to get to higher places. So remember that as far as safety issues. They should be able to turn a page in a book without tearing. Somebody was reading that and says, without tearing, why would they tear when they turn a book? But anyway, so before that, we usually use the cardboard books. Prior to that, because of that, I have a lot of books in my house that are incomplete because of all the tearing that the books go. They should be able to cut. Everyone's afraid to give them scissors, but it's very good. You know, the biggest thing that kindergarten teachers will comment about is your child can't cut properly. That's one of the fine motor skills that they really evaluate that in kindergarten, and they have them cut a lot. So cutting is a really important thing, believe it or not. Now you don't want to give them those sharp scalpels and blades to cut themselves within reason, but getting that. And then a tower to 7 to 9 blocks. We had blocks in our house all the time, and this is the one milestone I wanted to make sure my kid could do. At 18 months, I wanted to make sure they could do 6 blocks, and at 2 years, I wanted 9 blocks. So I was really adamant about this. It's fun to play with, but I realized that it really doesn't matter in the long haul, but it's a good dexterity thing. Speech, this is the big thing, and some pediatricians are more conscious about this than others. And I'll tell you, before I forget, how many here firstborn is a toddler? Okay, so it looks like the majority of it, which I would suspect. Because a lot of what I say is very practical to the firstborns when it's your firstborn or your only child. Because in reality, when you have 6 kids at home, some of these things are impractical. It doesn't mean they're wrong and you shouldn't try them, but some of them just time constraints and doesn't allow you to do that. Or if you're in a small house and you have 3 other kids, letting them cry it out and wake up the whole house is not very plausible when your older kids have to go to school. So some of these things you have to put in perspective, and I usually tell people, those that are the firstborn or have one child that's a toddler, believe it or not, it's actually easier because you can concentrate all your attention to the one child. There should be probably a whole nother talk on second children, middle children, baby children, because in reality, firstborns have done a lot of studies about it. Their personalities are different because of the way we learn to be parents. You learn from that first one. As much as he learns from you or she learns from you, you learn a lot from them on how to be a parent. You learn more from them than you do from your pediatrician or your family doctor. So speech. So they should be able to follow relatively complex verbal instructions. So, hey, can you go into your room upstairs and grab your grab your shoes? They should be able to do that. Okay? And for me, the understanding is more important than the actual communication. If they're able to understand what you're saying, to me, that means that their verbal skills are doing well, even though they may not be so verbal themselves. If they're in a bilingual family, usually the verbal skills, the expression of words will be delayed comparatively because they're learning 2 languages at once. And once they start to pick that up, it's very, very quickly, and they learn both languages at the same time. I am very much a proponent of learning 2 languages as best as you can, whether it's sign language, whether it's Spanish, whether it's French, whether it's Arabic, whatever language. I think if you have a natural language, you should only talk to your child in that language at home. So I am a big proponent of that. Simple two-word sentences, mommy, go. No, no, please. Or they will put two words together, very simple. Now again, firstborn boys usually don't do this as well as firstborn girls. Girls are more verbal, and that's not all the way around. I can tell you from my personal experience, I have 2 girls and 4 boys. My girls were way more verbal at 2 than my boys. They were more verbal at 18 months than my boys were at 3. Okay? It's not always like that, but my boys at 3 are actually better students and understand and can follow directions better than my very verbal girls at 2 because they listened to it. Not necessarily across the board, but that's just kind of a generality. So again, to me, understanding is more important than the speech to me. Now, your pediatricians a lot of times, or your family docs or nurse practitioners, will concentrate on the speech because there's always that fear in the mind, if my child's not speaking, there's something wrong with his hearing. Or if my child's not speaking, there could be concerns of autism. And that is one of those things that should be screened for when you're saying my child's really not talking at 2 months. They should do an assessment for, because they know what are causes of not speaking. But I'm telling you right here, if they understand you well, the fears should be relieved on that. So I know a lot of people focus on the verbal skills. And in reality, if they can verbalize what they're feeling, what they want, it's a lot easier. And those who are not verbal, it does make it a little tougher. I just wish they could tell me what they want, please, because I'm going nuts. I can't understand why they're getting so upset about it. And so speech is one thing. And then they like the word no. Any of you heard the word no from your toddler? I've never heard it. Never. No. One of the things I used to say, and I haven't said it so much, is they learn no because we tell them no a lot. And instead of maybe saying no to them a lot, say, we don't like when you do that. Or can we look at something else? Instead of just no, no, no all the time. Because they will learn from as many times as you say no, they're hearing that and they think, well, I need to say no a lot too. So, and when you start to get all the no's to everything, that's what we, I guess, officially call the terrible 2s have hit. So, although 3's tough. My 3-year-old's really tougher as a 3-year-old than as a 2-year-old, believe it or not. So it's not, it doesn't end at 2 necessarily. So speech problems, we kind of talked about that. And a lot of times subsequent children are being spoken for by their older siblings. And so therefore they're not talking because the older siblings give them whatever they need, so they don't, it's not a dire need for them to be able to communicate very well. Stuttering is a very interesting thing. One of my children, I remember stuttering, and nobody picked up he stuttered, but you would ask him his birthday, and he'd go, May 2nd. And he would do that. And I was like, oh, wow, he is stuttering. And I've taught many parents that it's okay to stutter. So there are little keys to stuttering. And so if your children, it is very common for kids to stutter. There's a couple key things that I tell people. The stuttering is usually at the beginning, okay? If they're stuttering in the middle of sentences, often, and not in the beginning or end, that's usually not necessarily normal fluency of speech. If they are dropping sounds when they're stuttering, that could also be another issue that's going on. What can you do about stuttering? Don't finish their sentences. Don't pressure them. Just listen openly. And then you should talk slower. You need to slow down your speaking. If you're a fast talker, your child will be pressured, and that makes stuttering worse. Okay. Emotional milestones, they're aware of themselves now as an individual. They're not just you. They're not an extension of mom or dad. So they know that they're an individual. They like routine. They're sensitive when something's not the way it should be. Well, that, like it says up here, that doll doesn't have the arm on it. Something's wrong. Or, Mommy, you're dressed up all nice with pantyhose and stuff. Wait a minute, I've never seen you like that. Something's wrong. You can't do that. So they are very routine, and it's hard to get them out of that. They start to imitate you. And we'll come back to this. If you can remember one thing is, throughout childhood, kids are going to remember more what you do than what you say. You can tell them multiple times something, But if you go do it once, if you don't want your child to cuss, then you shouldn't cuss. I don't care how many times you tell them not to cuss. If they hear you cussing, they'll say, oh, mommy did it, or daddy did it. If you don't want your kids drinking alcohol, you know what? You shouldn't probably be drinking alcohol in front of them, because they will see that. Oh, it's okay, it can't be that bad. Even though you tell them you don't drink until you're 21, they still don't relate that. So they see what you do more than what you say. And I'm not saying it's wrong to drink alcohol, because it's not. It's by far not. I can tell you, sometimes when the kids are driving me crazy, I need a little glass here. But I try not to drink in front of my kids. And then that comes to when we're talking about punishment, and we'll go into that in detail. But remember that quote. And that's not my quote. Many brilliant people have said that before me, so I don't want to take credit for that. Two-word sentences sounds like commands. So it sounds like they're telling you what to do. Just try to introduce thank you and please. I think manners are very good, and they'll start to understand that. And they do start to know that they're a boy and a girl and kind of the differences between that. Emotional milestones, they want to try to control you. They want you to do what they want, when they want, and all the time. So but it's very normal. They tolerate longer periods of separation, though. So you can actually leave them with the babysitter. I know you don't think you can, but you can. And if you parent with respect, empathy, and responsiveness, that will foster a strong foundation of the sense of self. So basically, you're trying to build them up. You're trying to respect them as an individual, not just you're trying to tell them what to do. You're trying to figure out what they want also. And sometimes that can be very hard, especially when you have 5 other kids that are asking for your time. Eating and diet. Everybody's here 2-year-old eats all the fruits and vegetables they're supposed to, and you never have any issues with them eating, right? Because I swear my kids are the worst eaters on the planet. I have had one kid that went 5 days and all he had was 3 bites of a chicken nugget. For 5 days! I had one child for 6 weeks, all he had was a s'mores Pop-Tart and a glass of milk. That's not all I gave him, but that's all he would ingest for that time period. And it was really bothering me, to the point where with my firstborn, I felt like I was fighting him feeding. I was just like, come on, you gotta eat, come on, please eat just one more bite, please, please, please. The more you struggle, the more you make a deal of it, the harder it's gonna be. You just need to put the food out there. They will eat what they want to. Don't make it a battle. Make it a pleasant time. And I'll tell you what, I learned that with my subsequent kids, and even though they are still not great eaters, they're so much better than my firstborn, because they started out horrible, and when I backed off and didn't make a deal and didn't care really that they weren't eating, even though my kids, I don't know if you saw the pictures, I can give you the age. You're going to guess 3 years younger on most of those kids because they're so small. My kids are tiny, and somebody here, their daughter goes to our school, so she knows how small my kids are. So, I was worried that they weren't getting nutrition. They still are healthy. So back off is kind of the statement I want to tell you. If you're really, really concerned and they're not growing well, you can add a multivitamin. The only thing I tell you about multivitamins are, if they taste really good, don't leave them open, because then their kid will overdose on them. So that's why I'm not a big fan of multivitamins necessarily. And the biggest thing to worry about really are things that they're going to choke on. Those are the biggest things I worry about. So this is a side safety note, and I tell all my parents that come to see me this is, if your child is making any sounds, you're afraid your child's choking, and he's making any sounds at all, leave him be. So he's going like that. Don't pick him up, don't rush him, anything, don't hit his back. Any sounds at all, let him go. It's when he starts going, that's when you would start to do the Heimlich on a 2-year-old. Okay? Everyone's freaking that their kid's going to choke, but when they're gagging, making any sounds, his cough, his gag response is the best thing to fight it. And the second you pick him up and rush him, you can make it worse. Okay? So back to nutrition. 2%, we're now at the age of 2 recommending 2% or skim milk for children. Now, my kids, being that they're very, very tiny and I want them to have calories, they are still on whole milk. So if your child's below the 5th percentile, like mine ride, I do allow whole milk, but the majority of kids should be on 2%. In the second year of life, they eat a lot less than what they will before that. So it is very normal for that. Don't stress if they're growing well. So you should still be going to your regular visits and making sure they're following along the growth curve. Couple of pitfalls that people fall into. Kids have food jags. Do you ever notice that the only food, like I said with this Pop-Tarts, your kid will only eat 3 foods? That's it. Okay? And that's called a food jag. Very normal. Other parents are going through the same thing. It really drives me crazy, though, when a parent comes in and they have a 2-year-old, and I'll ask them how they're eating, and they'll say, they eat all the fruits and vegetables and meats, and they'll eat everything I put in front of them. I'm like, still? At 2 they're doing that? And they'll be like, yeah, every vegetable I do. And I'm like, oh, wow, just think of the less frustration I would have had all those years if my kids would just eat like that. But that's not the typical toddler. The typical toddler will go through food jags, and that's okay. Also, don't be a short order cook. Don't sit here and say, oh, they didn't like our dinner. Let me make this too. Oh, they don't want that. Let me try to make this too. Don't do that. You can have 2 options. If they don't eat it, that's fine. Then they'll eat next at their next snack, whatever the snack was going to be. But you don't have to force them. They don't have to eat the meal then. And I think we're going to go through it. Make it a happy social time. We've had some family traditions at our dinner table. I'd like you to start some of them because they're kind of cool. And I hope our kids will remember it. When we sit at the table, even our 2- and 3-year-olds will do this. We ask each one of them what was their favorite part of the day. And we each one of them have to tell us what the worst part of their day was. And even at 2, the 2-year-old go, Mommy home? Mommy home? That's what he would say was his favorite part of the day is when Mommy came home. So my wife's a physician also, so when she comes home from the office, that's what he would get so excited to see her. So it's just something we do, and so make it happy. We pray together. I'm not saying that everyone has to pray together before, but that's a tradition we do. And we try to eat all our meals together. Thanks to you guys, I'm not eating with them tonight, but we try to make as many as we can. So toddlers imitate your manners, so have good manners at the dinner table. Playing with food is normal. The greatest gift I ever got for a baby shower, and this is no joke, one of my wife and I's best couple friends from college, they got us, and I thought it was weird at the time, but they got us a dustbuster. I'm like, what? Dustbuster? We just got a brand new baby, and they're like, you'll use this through your lifetime more than anyone. I've gone through 5 dustbusters. That's no joke. We have now 4 dustbusters in different rooms in our house because the kids throw foods on the ground, they'll play with it. I didn't want to make them not have fun eating-wise, and so I just, after the meal's over, I just take the dustbuster and so we didn't do a lot of mashed potatoes and stuff that's sticky, but we would just dustbust up, and it was great. So I recommend a dustbuster. Okay, so we talked about the power struggles and allow finger eating. Don't worry about the messes, seriously. Now, I mean, if you live in a $3 million house and you have fine china, and I don't know, but try to make it fun. Once the child's ready to leave, let them. Don't keep encouraging bites. I'm going to be honest, I'm bad at that. I'll be honest. I want them to eat one more bite. I want them to. But the more I back off, the more they will actually, we leave their plates out because they know they can't get any treat or any dessert until they eat their meals or until the next snack time or the next meal time is. Okay, so we leave their plates out, and if they want, they can come back and they can go eat on it. But I try, I'm going to be honest, I don't always make this, but I'll try not to try to force extra bites in them. Well, if you do, I'll give you a piece of candy. That's not what you want to do, okay? And then try to eat as a family. Oral hygiene. Brush their teeth. Brush their teeth at an early age so they get used to it. And brush it until they're 7, okay? And I don't know if your dentist tells you that, but they really don't know the dexterity of brushing well enough to prevent cavities until they're 7. Doesn't mean they can't brush on their own, but you should brush after them until they're 7 years of age. 15 to 25%, as it says up there, of kids will have cavities during ages 1 through 2. And you should be visiting a dentist. At least by age 2, you should have visited a dentist by then. Some people will say age 1, definitely by age 2. And this is another side note. The number one reason of getting cavities is from eating a lot of candies and not brushing your teeth. And the gummy bears that everyone loves, the fruit gummies, those are the worst offenders. Laffy Taffy, those Starbursts, because they stay on the teeth. Okay, and so those are the worst offenders of cavities, believe it or not. I'd much rather them eat a chocolate bar than something sticky like that for their teeth. But After that, do you know what the second leading cause of cavities in kids are? What's that? Juice? Well, okay, it goes in the same line. And what I was looking for was mommy kissing them on the mouth. Second leading cause. Did you guys know that? Your enamel is an adult enamel. Your bacteria in your mouth, yes, you have bacteria in your mouth. Your bacteria doesn't penetrate your enamel, but your kid's enamel is different. And so by kissing them on the mouth, starting at a young age, is a second leading cause of cancer, especially if you had cavities as a kid. Now, of course, if dads too, that's just not the mom, but the mom tends to be the one kissing them both on the mouth than the dad. And so dad, same way. If you had cavities as a kid, you're increasing their likelihood of having cavities. Okay? So that's just a little side note about that. So I don't allow anyone to kiss my kids on the mouth at all. My wife didn't like that idea, but she followed suit. And I have to watch what I say because somebody in here can actually go to my wife and actually tell her what was said here. So, okay, thumb sucking. I am a big believer, and I was not prior to my first kid, but I'm a big believer in pacifiers. Okay? And the AAP actually have now said that they want you to introduce a pacifier because it decreases the risks of SIDS. The real reason I like it is when I think it decreases child abuse, because if I can pop that in and get them to stop screaming, I feel like I'm calmer. But number two is, if they start sucking their thumb, you pop the pacifier in so they're not sucking on their fingers. Because you can always take a pacifier away, you really can't cut a thumb off. I mean, at least in this country you can't. So that was a bad joke. We'll back up. That was a bad joke. I would never. So I'm a big believer in that. Now, some kids still suck their thumb. No matter what you do, they're going to suck their thumb. I still have two 18-year-old parents. They are parents at 18, and they still suck their thumb when they come in to see me. Okay, so I take care of the mom and I take care of the kid, and the mom's is still sucking the thumb through the whole visit. Okay, so it's just a comfort reason. So how can you stop it? One, like I said, if you can get them diverted to a pacifier early on, that's probably the best way to do it. Second is, you can just start telling them, hey, let's keep your hand out of your mouth early on, hand out of your mouth. Big boys, big girls don't put hands in their mouths. Aversion training. What I suggest doing is every time they have their thumb in their mouth, you give them a teddy bear and a blanket or something to hold while they're sucking their thumb. You want to convert the thumb sucking soothingness to the holding the bear in the blanket, if you can, because they're doing this as a soothing. So hopefully they will eventually, every time they suck their thumb, they'll feel like they have to have the bear and the blanket. And hopefully they will then learn they just can have the bear and the blanket or whatever mechanisms you can have. The best thing is have something that they have to actually hold with their hand so they won't be sucking on their thumb. Third thing I do is if they're a little older, 4, 5, or 6, I have a mirror, a handheld mirror, and I have them look at themselves while they're sucking their thumb. So yes, you can suck their thumb, but you have to watch yourself do it, because they don't see what they're doing. They don't even realize they're doing it. So every time they suck their thumb, they got to put the mirror up, and they will then eventually start to, as they get older, hopefully say, "Oh, I don't like the way I look," or "I think that looks." They don't even realize they're doing it. And then, and it does say here that child's really need to quit, and that's why the mirror, a lot of times, I'm hoping that will trigger them to say, "Oh, I do look kind of like a baby," or "I don't look." It doesn't look good to do that. There are dental appliances. I did see a 9-year-old girl with one that I was like, wow, that's weird. I thought her braces had come off weird, but no, it'll stick out into the middle of her mouth, like this far above her tongue. So if she tries to stick her mouth in, it pokes her. It was pretty impressive. I hadn't seen one like that in a while. And then you can also go with a psychologist and kind of do what's behavioral reversal training. I have not used that before. Common illnesses. The biggest fear of parents is, oh my God, my kid's got a fever, I got to have them get seen. Usually by age 2 or 3, the majority of illnesses are related to viruses. Fever is not a bad thing. That's your body's way to fight infection. And my wife and I disagree on this a little bit, so she always wins, of course. But I try to let my kids go with the fever and not give them Tylenol and Motrin. And most of the time we can do that. The only times I use Tylenol and Motrin is my kid is feeling so miserable that he's crying from the pain of the fever that's causing the headache. But a lot of times with fever, I let it ride out. And I'll tell you what, my kids have the shortest illnesses of any kids, because the fever, I think when you stop the fever, you're stopping the body's own response to the infection, And so the body's not able to mount the infection as quick as it should. And so a lot of times, now if the kid's vomiting because of the fever or crying so bad, again, I think you should make the kid comfortable. But if he's not that uncomfortable, just whining and laying around with the fever, I propose letting it go, but a lot of parents can't. Ear infections, very common, but less common than the baby ears. And the good thing about 2-year-olds is they'll give you signs they have an ear infection in most cases. Not 100% of the time, but they'll usually let you know. Whereas a little baby that's 6-month-old, why are they fussing? I don't know. And so in that case, you need to take it. I'll be honest with you, it is so nice that I can just at home take my otoscope and look at my kids and I don't have to go to that is worth all the money I paid for medical school to be able to do that. I'll tell you what. Urinary issues, girls a lot of times will develop vaginal issues and you'll think she's having a urinary tract infection, and even your doctor, the child's doctor, will think they have a urinary tract infection. Actually, the majority of the time it's a vaginal issue. Hygiene is the biggest thing. And with my 2 girls, that's one of the advantages with a boy over a girl is the cleanliness is so much easier with the boy than the girl, with the wiping and the toilet training. And so these girls will inevitably drip urine into their vaginal area, or when they wipe improperly, or they'll get irritated. And when urine touches an irritated vaginal area, it burns. It really does burn. You'll get odors, you can get rashes, and so a lot of people will mistake the burning with a urinary tract infection. One of the keys that I tell people is, for girls, is if the burning is throughout peeing, or at the beginning and throughout the peeing, it is most likely urinary tract infection if it's a normal stream. If it occurs at the end when the stream's lower and the urine's dripping into the vagina, and that's when the pain occurs, it's most likely vaginal pain that you're dealing with. And so one of the things I do, home remedy, and I've done this with my girls, is after I bathe them, I just sit them in tub water, no soap or anything, just enough to for them to sit and cover the vaginal area, and I put a cup of white vinegar and let them soak, and that just kind of helps the cleanliness of it. So that's what I do. 1 cup of white vinegar in the bath, and let them just sit in that area. So, and then bubble baths. Everyone's worried about urinary tract infections with bubble baths, but actually bubble baths cause the vaginal irritation. It doesn't really cause urinary tract infections. There's an indirect way it causes urinary tract infections that I'm not going to necessarily explain, but it's really the vaginal irritation that bubble baths, that's the problem with bubble baths. Febrile seizures, I just had another kid who was 16 months that just had a febrile illness with a fever. Very common, scary as heck for you, the parents, for your kid to be seizing. But if your child has a high fever, most of the time, 95% of the time with febrile seizures, your kid will have the seizure and you won't even know they're sick because it's on the onset of the fever when it first spikes. I'm not going to go into details with this, but all kids outgrow this. There is a slight increased risk of epilepsy, seizure disorders, having permanent seizures, but for the most part, most kids outgrow this and do fine. Heart murmurs, very common. 1/3 of kids at some time in their lives will have heart murmurs. A lot of the doctors won't even tell you because they hear it so often that they don't want to bother you with it. Nursemaid's elbow. How many of you have heard of this? A couple of you? Very common thing. A niece of mine had this. It's when you're holding your kid by their arm, and they fall down like off the road or something, and you pull them up by their arm to prevent them from falling, and you slip out. You basically, what we call sublux, or separate the elbow here, and they'll be in pain holding it like this, not wanting to move it, and they won't actually be screaming in pain. They just won't want to move it, and they won't want to use it. And the treatment actually is like that to pop it in, but probably want to go to the doctor to do that to make sure. I've had to do that more than a few times. In-towing, a lot of kids will in-tow. I get this complaint all the time at the 18-month and 2-year check about in-towing. In-towing is very common, and unless it's worsening or bowed-leggedness is worsening, it usually just kind of, they'll outgrow it. They'll probably still have a little out-towing, and it comes from the fact by how they were in the uterus. When they were in you, they were bow-legged to begin with, okay? And it just takes more walking and time for them to outgrow that in-towing. But if it's getting worse, you say, Dr. Yagmore, it wasn't that bad, now it's gotten a lot worse. That's abnormal. It should not be getting worse. So at 18 months of age, you shouldn't come into your doctor and says, all of a sudden it got a lot worse. And eczema, The biggest thing you can do for eczema, if you have, and that's really severe dry skin, the biggest thing is to keep them moisturized. Use non-perfumed creams. So petrolatum, it should be the basic ingredients. And if it smells good, don't put it on their skin. Okay? And the more you moisturize them, the better. More severe, you should see your doctor about that. Or see the child's doctor. Bedtime. I am a big, I push bedtime routines and good sleeping from the get-go. At 2 months, I expect your baby sleeping through the night. All 6 of my kids slept through the night by 2 months. All 6 of them. And I think I was able to be a better parent because I could sleep. I could handle things a lot better. As long as they could be terrible during the day, but if I could get them to sleep that 8 to 10 to 12 hours in a row at night, I was rejuvenated and I can do that. So even though it sounds mean, some of the things that you're letting them do to get them to sleep at night, it pays off because you can be a much better parent, much more patient. So in the toddler years, if your kid's not sleeping through the night as a 2-year-old and haven't slept through there, God bless you for dealing with that because that's a hard issue. And a lot of times by then, if they haven't been sleeping through the night, I recommend going to University of Nebraska has a sleep disorders clinic. But in reality, the treatment of not sleeping through the night is letting them scream it out. That's what they'll tell you, but no parent can do that. I have let my kids scream for 4, 5, 6 hours at night before because I didn't want them to revert back. I know that sounds mean, but in reality, that's on a kid who's been long-term. Now, I wouldn't let a 2-month-old do that. There's no way I wouldn't let a 4-month-old do that. Okay, I would not let them do that. There are limits on those ages, but as they get older, if you have a 2-year-old who still hasn't slept through the night, you're going to have to take some tough measures. No, I won't talk about that. Okay, so they need about 12 to 13 hours of sleep per day, and so some of that's done through a nap. And then everybody asks me, well, when should I get rid of the nap? Well, every child's different. Some 5-year-olds still need naps. Some 3-year-olds, 2-year-olds don't need naps. Everyone's kind of individually. If you're finding that towards the early evenings they're getting really crabby and you can't handle them, they probably need a nap. If they don't have that and they're sleeping 13, 14 hours a row at night, and when they wake up they're refreshed, can go the day pretty well, probably don't need a nap. Sometimes the nap's for the parents though, so that they can get something done during the day. Bedtime ritual, you want to keep routine. You want to do a routine every time, whether it's a bath, a cup of milk, brush the teeth, read a book with them, and put them to bed. You need to have routine. We still lay, I don't know because my oldest is in class with somebody here, so you can't let it out, but we still lay with all 6 of our kids at nighttime. We still lay with them. And I'll be honest with you, with my older ones, that's when I get all the information. So that's a routine we've done, and it's a bonding routine we do. I mean, my 12-year-old boy, I may not get him to talk to me during the day about a lot of things, but at nighttime, he opens up about everything. Actually, we've done a lot of our sex ed teaching at nighttime during that time. So just get a ritual that works for you guys and stick with it. Transition options. We do have blankets and bears that we use to help them. I have 4 of my 6 kids use transition options still, objects still. Be firm. You can't waffle all the time, but it's so hard because you're tired too after your long day and you just want them to go to bed and stop. I'm not reading another book, please. Nightmares and night terrors, which we should put in their sleepwalking, sleep talking, they're all in the same spectrum. So this usually happens about an hour and a half after they fall asleep. Is night terrors, sleepwalk, and sleep talk, and they're in their deep sleep. Nightmares can happen at any time that they're dreaming, actually using their REM sleep, their lighter stage areas. The difference between nightmares and night terrors, they're fully awake. They're understanding everything that's going on. Night terrors, they're not fully awake. You can tell their name and stuff, and they're not responding to you. All but my baby has had one of those, have had night terrors. So I'm an expert at them. Some kids, they say you just calm them down and put them back to sleep on night terrors, so it's pretty common. One of my kids had them so bad, the only way, after 45 minutes of screaming, I had to just try to get them to wake up. But that's not the norm. Normally, you just try to calm them down as best you can and just get them right back into that deep sleep. But then some of my kids now I have a couple of night walkers that walk around. Not as bad, but they do. So if the pediatrician's kids do that, then it's got to be okay, right? So don't freak out about it. Although the first time your kid comes out and he starts screaming about something and you're trying to talk to him and he has no clue of anything's going around, and you're like, what? It is kind of weird. Big bed. I'm a proponent of leaving them in a crib until they can climb out of it. And I think that's one of the ways to get a kid to sleep well, because it's easy then to just walk out and let them kind of cry themselves out. When they can get out of the bed really easy, it's hard, the big bed. So I see 16, 17 months olds in big boy beds, and I'm like, why, if they're not climbing out? Now, luckily, my kids are not the most great at gross motor skills, and so they weren't climbing out until they were 3, so we got to keep them until 3, which was nice. But so climbing out, the danger issues. And when I say climbing out, I mean at the lowest level. Drop the crib down as far as you can and keep them in there, okay? Anxiety and shyness, we just kind of, some kids are shy, some kids are anxious. You know, some kids feel comfortable in certain clothing. Don't take, you know, if they go to daycare, we always take the teddy bear with us to daycare because that's his transition option. It helps break the shyness or the awkwardness that he has there. Crying, they're just trying to regulate their emotions. Some kids will cry a lot easier than others. And I want to say one statement here is with discipline, because I know a lot of people have questions about discipline. So discipline is based on 2 factors. One you can control, one you can't. Every kid is different. Every kid has a different temperament. There are some kids a lot easier than other kids to raise, okay? And I don't know your kid, and he may have a much harder temperament than my kid. So some things may work for my child that may not work for yours. But I can tell you within my own kids, I have some kids that have been a lot easier in their 2s than others. Okay, so you can't control their temperament. What you can control is your response to it. Okay, you can manage it to make it so it doesn't escalate further. Okay, so you may, even if you have a tough kid, a temperamental, tough, stubborn kid, you can still prevent it from escalating worse. And so we'll kind of talk a little bit about that. So parents need to comfort cries of pain, tiredness, and discomfort. But if you're frustrated, don't act upon it. Let them go. Let them just cry it out. Okay? Put them in timeout. Put them in a safe spot. Go do something that will get you less frustrated, because you will say and do and yell things that you really don't mean, and it can escalate things. So, do I do this? Do I escalate? Do I get frustrated and yell at my kids sometimes? I do. And I'm a pretty patient guy, but I do have my limits sometimes, and I then have to just walk away. And my wife and I tag team, so if she sees that I'm getting frustrated, she'll be, hey, okay, I'll take over here. Or if I see she's frustrated, I'll take over. So we do tag team. The single parents, I don't know how you do it, because you don't have that tag team. That's tough. And I have utmost respect for single parents that can do that, because I, as a single parent, I don't know. If my wife ever passed, I don't know how I'd be able to parent without her. Well, let alone even, never mind. I hate that thought. Okay, the sleeping. Okay, so crying, then sleeping. We talked about these. Be rested. You need to be rested too to deal with this. Negativism. So this kind of goes into the terrible twos, and I want to stress the pick your battles. I have a philosophy that I just told somebody earlier today. It's my pick your nose philosophy. Okay, you like pick your nose. If your child does something, if you need to pick your nose before you say no, don't say no to everything. Just don't say no to that. If you can avoid a no, if you can avoid a battle, try to avoid a battle. There's certain things that I say no to definitely, and they're safety things. Okay? He's about to stick a fork into a plug outlet. You know what? I'm not thinking about that. That's a no. My kid tries to run across the street. There's a no. He needs to know that. But can I eat this piece of candy? And it's right before dinner and you don't want him to. Instead of saying no, try to distract him. Oh, can you help me with dinner? We got to get it ready. Or, wow, you know, there's something neat over here. Let's play this game while I get dinner ready. Try to distract him as opposed to just saying no. Does that make sense? So avoid the battles if you can. Because the power struggles lead to the temper tantrums. He wants it. And if you tell him no, he's just going to keep raising the stakes. And mom and dad both have to be on board. well, mommy said yes that last time, so I'm going to keep going and going and going and going because it worked with mommy because she gave in. The thing is once you say no, put your feet in the ground, stay there. Don't give in. If you give in to a no, he's like, I can keep throwing temper tantrums to work. And for every one no that you give in on, expect 5 or 6 that you've got a battle now with. So don't give in on your no's once you say it. That's why pick your no's. Don't say them all the time because you got to stand firm on them. There we go. Redirect rather than dictate. Temper tantrums. Basically, don't yell back. Talk calmly, although that's tough. Don't reward the tantrum even in public. I was in Walmart the other day. This is not a lie. The Gretna Walmart, walking around, and my kid and I had a struggle. And I was nice and calm about it, but no, he was going to throw a fit. And so I just kept walking for 45 minutes through the whole store. He was screaming his head off. Everybody's looking. Some are smiling and saying, yeah, I understand. Others are like, there was another pediatrician there. I'm like, here, you want him? So she's looking at me like, but anyway, I didn't give in. And you know what? Afterwards, what he said was, well, you know, next time we go to the store, I'll be good so I can have that. And so it worked. He understood it. But it wasn't easy going through the 45 minutes of everyone staring at you. My wife can't handle that, so I don't let him take her. She's not allowed to take him to the store. Breath holding spells, I'm going to briefly go over this. These are really scary. They do outgrow them, but basically it's always preceded by some kind of cry, and then all of a sudden they hold their breath and they pass out. Some actually can look like they're seizing. Fairly common, but they do outgrow it. So, and don't let this limit how you discipline. Because you're like, oh my God, if I don't give in, they're going to have a breath holding spell, and I don't want that. Don't do that, because that's even worse to do. They do outgrow it. Biting and hitting, we've had this in our house. Basically, kids who can't communicate what they want a lot of times will bite and hit. I also tell parents, don't play with your mouth on them. Don't go wah, 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 or don't blow bubbles on them, because they are remember what I said, they imitate you. So they think you're playing with them, and they don't realize that they're biting and hurting you a lot of times. So if they're biting you and they're not frustrated and mad, more likely they're imitating you and playing with you. If they're biting because they're mad, it's because they can't communicate what they want. So try to be proactive and see what they're doing. If they're ahead of time, you know this is a situation where they bite, then let's prevent that from actually occurring. And then if they do bite or hit, you say, no, don't bite them back. I've had parents do that. I don't know why. But say no and move them from the situation. That's what I tell you to do. Parents will tell me they bite back because, well, they don't know how it hurts. So I want them to know that it hurts. I'm like, oh, that doesn't work. That reasoning does not work. Okay, discipline, we kind of talked about that. And I just want to hit this no hitting or spanking. Do I believe that hitting or spanking a child is child abuse? No, I don't. I don't at all. Now, the problem with spanking and hitting is, one, we're not hitting or spanking out of love. We're spanking because we're mad. And a lot of times that's not right. So if you could say, okay, in an hour I'm going to spank you, and then an hour goes by and then you can spank them and they can understand that concept, which they can't, then I think it would be a little bit more acceptable. But the real problem with hitting or spanking is the comment I made. They learn by what you do, not what you say. Mommy spanked me, or Daddy spanked me to get me to do what he wanted. I'm in school as a kindergartner. This kid's not doing what I want. I should hit him so he will do what I want. And every kid that has gotten kicked out of kindergarten for hitting or spanking, I ask parents, well, what'd you do when you got home? Oh, I whooped him. I'm like, oh, okay, well, that's why he got kicked out for hitting, because he saw that that's the way to handle things. So that's why I don't believe in spanking. Does that make sense? Because some people do believe in spanking, but my premise is don't spank because they learn from what you do. It's not because it's child abuse. Now, of course, if you hit or spank and you're doing it with force, of course there is a risk of that. Time out. There's a book, a discipline book that Children's Physicians gives out. It is an excellent book. It's about a 30 to 40 minute read. I give it to all my parents starting at 18 months. Great on how to make time out work. If it's not working, it tells you how to make it work in each different situations. It'll check, you need to make it a place where it's a common place where every time you're putting them in that same spot. and don't like anything fun around. And then it explains to you exactly what to do. It's usually to diffuse the situation. And there's time limits on it. So it's basically 1 minute for every age they are. And I've used it. I don't start it just at 2. I've started it at 15 months. I think that's a good time to start it. Discipline. We kind of talked a lot about this. And again, don't use food as a reward or punishment. Children learn proper behavior through your example. So if you're staying calm in situations, you don't blow your top about things. If things aren't going the way you want, you talk calmly and handle it. They'll learn from you. They feed off you. Bossiness and negotiations. Give them choices. I think this is more also, remember that as you're disciplining older kids. Instead of, with my older kids, I tell them, you know, you can do what I say, which is go take a shower, or I'm going to take away all your games for a week, or I'm going to make you go and clean your room and you're not going to get to have your friend over tomorrow. Instead of just punishing them for not doing things, I give them the option. Here's your 3 choices. Pick one. And if they don't pick, then I pick one. 2-year-old, it's not going to work. So you just have to be very basic on what kind of choices you're giving them, whether it's for discipline or other issues. Don't give a choice if a choice is not an option. Don't make a threat you can't follow through with. Like, you are never going to see your grandparents again now. Well, come on. Really? You're never going to let... Now, of course, if you and your mom or dad had an argument and you're not talking to each other, that's one thing. But, okay. Potty training, because I want to have some time for questions. So real quick on potty training, I don't think there's a problem with starting too early. People say, you can't start when do you know they're ready? Introduce it. Put the potty seat out. Let them play with it. Have them sit on the toilet. Have them watch you go. Have them watch the big sibling go. Make it a fun thing, okay? It only becomes a problem when we're forcing it. Oh, they're 4 years old and they're not potty trained. You're forcing and pushing and pushing. So what I do is introduce it early on, so they're not scared of it, and it's just kind of a routine thing. But I can't give you one thing that's going to work for everybody, because there's so many different ways to potty train. Play education, let them be imaginative, free play. Structured play, I'm not a big fan of for 2 years old. Let them free play, let them imagine. I'm not a big pusher of preschools at this age either. So let them play outside. So my kids are great about that. Let them play with water, sand. We've got Play-Doh is a staple in our house. We have sand, we have moon sand. We have so many things. They just love to play with those. So, so that was what I was saying. And then kids parallel play. They won't necessarily, don't expect them to get in and play with other 2-year-olds. 18 months to about 3 years of age, they play next to each other. So it's not that they're being mean, that's just kind of what they do. At age 3, they learn to interactive play nicely. Mom or dad's day out, get some time for yourself. And we're going to talk about that. No TV for children under 2 years old based on the AAP. I feel that if you watch TV with your child and interactive with your child while watching, that's not bad time, screen time. It's when you plop them in and use them as a babysitter that it's bad screen time. So I have no problems. You're watching Dory and it's like, okay, now what color is that? Or, oh, in the backpack, what is that? So you're kind of talking and interactive with them. That's actually what I call good screen time, okay? Children with developmental delay, your doctor should be screening for it. There are studies that show that early intervention does work. It does work, meaning getting them into the school systems early does help with that. Recharge. My wife and I have a date every second Saturday and every fourth Saturday of every month, like clockwork. We have a babysitter for the second Saturday and a babysitter for the fourth Saturday. And we pay a lot of money for 6 kids. Can't wait till our oldest is old enough to do it themselves. It'll save us $100 twice a month, 100 more. But you got to do it. And husbands, please spoil your wives. They take care of your children. And if you spoil them, they'll spoil you. Now that's wedding advice. That's marriage advice. So I'm maybe stepping out of my balance here now as a pediatrician. Okay. Pearls for surviving the 2s. This is normal. I think God made 2-year-olds so cute when they cry because he knew they'd cry a lot. And sometimes I would be like needing I'd be like, well, my kid hasn't cried a little bit today. Let him cry a little bit, so because they just look so darn cute sometimes. After a while, it gets old though. Encourage the independence and learning. Make them feel like they're in charge of what's going on, but in reality, obviously, you guys are in charge. They will not remember you as the bad guy. Just because a lot of people are like, well, I don't want them not to like me. Well, they won't remember that. Even my 12-year-old, when I have to discipline him, he doesn't remember it. Routines from the early on, and do enjoy your toddlers. I can't believe my 12-year-old's 12. I miss him as a toddler. I can't. Every time I look at him, I'm like, oh my God, they're growing up. And I don't like that. I know that's bad to say, it's weird to say, but they do grow up fast. And this is just a small part of their lives. It's a really hard part, the toddler years, but with some of this advice and the consistency, you hopefully will be able to get through that. And those are some of the summary stuff, patience and respect. And there's my family, South Dakota at Reptile Gardens. 3, 12, 7, and this was 2 years ago. This was a year and a half ago. So 3, 12, 7, 5, 7, and 8. So those are twins, if you haven't figured it out. Okay. I didn't have the Irish twins. They are actually genetic twins. Okay, any questions? Yes?
We just transitioned to a big boy bed, and like I cannot, he begs, like freaks out when I shut the door, but every night he's popping up, and I have a baby, and it's just, I can't do it.
So he was climbing out of the crib?
Yes. Oh,
he
yeah,
was.
yeah.
Okay. Yeah. Go ahead.
Just shut the door and let him cry, like.
You do, and at that point, you know, if you need to put on a lot of lights or just leave the lights on, that's okay. We have to do that sometimes. If he is screaming their guts out, I felt bad one time because my child cried so much she vomited in her bed, and I didn't go in and check on her. And she woke up the next morning and was laying in vomit. So I do recommend every 15 minutes of crying just to kind of go in there to check it. But yes, you just have to close the door and let him kind of cry it out.
In the door, because like, oh, what if he has a dirty
Right,
diaper?
right, exactly.
Yeah, and that's when he'll get up.
Okay.
Like, you know, like it'll be like 2 in the morning. Come, you know, Mom.
Wow, he's still awake then, huh?
No, I think he just gets up and then gets up. Like if he just wakes up and gets up.
Okay.
Ours is an awful sleeper too. I could totally.
We stood by the door and kept putting her back to bed. I mean, I would say 30, 40 times the first week, a night is how many times. I mean, literally put her back in bed, put her back, and now she never gets out of bed.
Right.
But
So,
I mean, for a while you just were putting her back in bed.
Right, and you can't let them get up to get up. But what I actually recommend if they're opening the door and getting out is actually putting one of those knobs on. The only downside to that is, I guess, if there's a fire or something, but you would obviously go in to get them. And then making their room like where they sit and can't play with many things. It's a tough situation. In reality, it comes into they've got to stay in the room, they've got to stay in their bed and kind of cry that out. And it takes, at 2 years of age, if you're dealing with this, it takes 3-4 months of doing that. It's nothing in a week that's going to take care of it. It's just consistency. Great question. That's why I said at 2 years, those are tough things. And it's a transitional thing, too, that makes it hard. Yes?
I got my son to, like, he would be waking us up in the middle of the night. He'd go to bed fine, everything was fine. He'd sleep until, like, midnight or 2 or whatever, and then he'd be waking us up, and he was doing that every night. Finally, I just put a sleeping bag next to my bed and told him, okay, when you wake up at night, just come on in here and just lay down. And slowly, we've been creeping it into his room.
The sleeping bag?
Yeah.
Yeah, see, there's different ways to do that. There is different ways. The thing is, don't let your kid in your bed. Don't let them in your bed at any cost. Even when they're 2 months, 3 months, 4 months, don't let them in their bed. It's not good for your intimacy either.
Going to that, I have a 2-year-old in my bed.
Okay.
We're working on getting him out. I'm trying to get rid of the pacifier.
Okay.
But he starts sucking on his thumb. Should I wait to get rid of the pacifier?
I do recommend that, waiting if you see that he's transitioning to his thumb.
He'll be standing there when it's time when he would have it, and he'd be sucking on some, his finger and covered in drool.
And then again, during this time, you can transition to other objects.
Yeah, he loves my hair. Is there something? And it's only my hair. Like Sissy's hair, Lindsay's hair works sometimes. But it has to be, mom's hair.
As a transitional thing. That's tough. The thing with binkies, too, is some people advocate cutting them, smaller. If they're not thumb suckers, we advocate picking a date and just losing it. And just losing the binky.
He's bit through some, and he just turns it around until he gets it to where he wants
it. And that's a tough issue, but I really think binkies are better than
thumbs.
Because
that's what my philosophy is the same as I can take that away, I can't cut the thumb off.
Exactly. Yes.
My daughter has separation anxiety with me. Even if I go out the car and my husband is there, she cries a lot. And I already explained to her, I'm coming back, and she kind of tried to calm herself and say, Mommy's coming back, but she's still crying and she's really suffers.
Okay. So the question then would be, has she ever done preschool daycare with other kids, or has she been at home with you the whole time?
She's been with me all the time, and now I'm trying to take her to the gym and let her for an hour.
Yeah.
I have a day out, fun day out, Wednesdays. I'm trying to
Good.
do it, but
Yeah, and it's okay to let her cry about that, though. It's okay to let the more times she does cry, eventually she will outgrow that crying. Okay, because she knows she will start to learn that even though she was gone for a while, she did come back. So it's okay to let her cry about that, is what I would tell you. Great question. Yes?
I have a question about like self-limiting behaviors like headbanging.
Like what? Headbanging?
As far as like what the cause typically of that, and then should you ignore it, correct it, how, you know, as far as consistency, what's the best approach?
So that's an excellent question. So headbanging, I have never seen a kid headbang themselves so much that they hurt themselves. So it's not going to be an issue of safety, headbanging. So headbanging can be an odd behavior, and it can be a normal behavior. So you have to look at it the whole spectrum. So if your child who's a headbanger is delayed, doesn't speak, does other odd finger movements, doesn't point, has other issues, it can be associated with developmental issues, okay? But for most kids, it's a soothing issue. That's just how they soothe themselves. They're used to soothing it. And just like any aversion training, you can just say, oh, let's start with gentle reminders. Please, you know, let's not headbang. Let's do something else. And just gentle reminders. And if it continues on, then you can do more of the aversion therapy, like having put some kind of mirror so that it's in front of them so they're seeing themselves headbang and other things like that. And other comfort items. So when they're headbanging, they're holding on to their teddy or they're holding on to something else.
I guess, could it be a seeking attention thing too?
Yeah, and it could. That's why you just a gentle reminder for it. Sometimes it's hard to say if you want to ignore it or not. Now, if he's doing it because, yeah, that's a hard thing. It can be an attention-seeking behavior. So you could, for a period of time, ignore it. And if he continues despite you ignoring it, then you might want to try the other techniques.
And it's usually like if I put him down, it's about 14 months if I put him down, or if I give him a decision he doesn't like, and it's not often. It's probably a few times a week he'll do it, but he looks at me, so I think it might be attention seeking.
Okay, no, so the difference is, okay, so he's doing it in response to something you're doing. So then in that case, you ignore it. Yeah, that's different. But there's some kids who just do it when they're laying there watching TV, they'll just start banging their heads. And that's kind of what I was getting at. Yeah. So you would ignore that. That would be the best way. Great questions. Wow. Yes.
My struggle is my daughter has long hair.
Okay.
And every morning it turns into a fight trying to, because I know that it's painful sometimes when it gets tangled. I have no detangle spray, but it's still, she remembers when it does hurt. So it's a fight every morning just to try to brush her hair.
Yeah, so we have that huge fight in our house most mornings with our daughter. So we have tried basic techniques to do that. So what we do is, believe it or not, we have her shower and we put it in a ponytail before she goes to sleep, and it makes it a lot easier. I'm just giving you some practical things that we've done. For 7 years we've been dealing with this. And some kids are just more sensitive with it. We let her start to brush it herself, but she's how old? 2. That's kind of hard. There's different ways to brush it, but that is a hard thing. And you got to kind of meet halfway. Let her do some of it, and then I don't have the best solution to that. If I did, I would use it on my kids. But the detangler is a great way. We use conditioner with our kids, and that helps. So I never thought
conditioner helps with our daughter too.
Yeah.
I had a question about if the child is screeching. She's almost 3 now. She's almost 3 and screeching.
Screeching.
And it can be from frustration. It can be just because she's having fun, or it can be just almost like she knows that it's irritating, and so she's going to continue to do it.
So
is time out a good?
You could, or ignore it is the best thing. Act like she's not even doing it is the best probably way to do that. Because if she's doing it to get the attention and she knows it bothers you, if it doesn't bother you anymore, I mean, this is going to sound odd, but when my child's screaming, And there's nothing I can do to stop him, and he's been screaming while I'm like, scream a little louder. I want to hear it. A little louder, scream it. And you know what? He stops because he doesn't want to do what I say. So believe it or not, I've used a little reverse psychology on him. My wife hates it when I do that, but that's sometimes the only thing that works for me is to actually egg it on, to ask him. Now, it's probably not your best maneuver to use all the time, but sometimes when I'm at my last dime and I've taken the time out, I've ignored it, and it's just getting worse and worse, and I know I'm getting frustrated. For him, that works. With my other kids, it didn't work. So you have to, it's an individual thing. So that's something right here.
My daughter, she's 2.5, and she's very independent. She wants to do everything by herself, but my biggest struggle right now is whenever we go somewhere, she doesn't want to stay by me, hold my hand, sit in a cart. She won't sit in a stroller, so she's constantly getting away from me. Like we went to the pumpkin patch and she got away. We were there for 15 minutes and ended up leaving.
Yeah, and that's a really tough situation. The expectations would be then, if she's not by you, you do just like you do. You leave every time, and if she's having fun, you just continually have to be consistent on if she leaves your side, then you're done doing what you're doing. But albeit my wife hates it, other than a leash, which I don't think that's the best thing to do. Yeah, so that's about the only thing I can offer on that. Maybe the expectations, if she's very verbal, the expectation is telling her before we go, now if you don't do that, and just continue to do that. And then if there's one time where she actually does stay by your side the whole time, reward her for it. And reward the positive. Yes?
My daughter is in a phase of boycotting pants.
I'm sorry, say that again?
She does not want to wear pants. She's
okay, we're there right now with my 3-year-old.
It hasn't been that, she's gone through phases before, afterwards, and what have you. Well, I started potty training now yesterday, and I mean, it turns into a battle because it's like, I feel terrible because I'm trying to roll her back over, get her pants on because I gotta be going to work or, what have you. And so now she's sitting on the potty, well, now she takes her pants off. And then I'm like, oh, once the door is back on, put your pants back. No! And then she goes and she hides or she crawls between the wall and the couch. And I'm like, I don't want her to think it's okay. And I don't want to let her run around with pants on and be like, okay, fine, because then she's going to think she can do anything she wants. So it turns into a battle, but I don't.
Yes. So one thing is try to give yourself enough time so you're not rushed. Is one thing, because we tend to make things about a word rushed. So the other thing to do is a positive. If she does put her clothes on, reward her for it, and reward her like when she wakes up, oh, your pants are still on, let's do this, or let's have fun time or free time. But you have to be consistent with it, and it's not easy. It's not an easy battle. With my 3-year-old, we've done 2 or 3 weeks of convincing we need to wear pants. We just need to put pants on. So, yeah, and it is, but just be consistent, and when she does do it, make a big deal out of it, and just keep reinforcing the positive, but that's a tough situation too. Yes?
I have a very independent 21-month-old little boy, but my power struggle with him is he wants to do everything himself from I get the Q-tips out to clean his ears or try to clip his nails, and it's like a power struggle. And some of those things I know is okay, certain things to let him just do for himself, but certain things is like a safety thing. I don't want to, give him the clippers and stuff like that. How do you make that not a battle of him, but let him be independent?
Okay, so no, that's a great thing. So I'll be honest with you, my firstborn was like that. We clipped his nails while he slept. That's how we avoided it. My other kids didn't mind. So you can, now again with the Q-tips, I want to stress, never go inside, just the outside. Do it while he's sleeping, if you can do that. That's the one option we did. But if he's fighting you on it, he wants to do it, and then that's fine. He can do it. He can do it, and then you slip in and just kind of try as best as you can to minimize, but be in control at the same time. And it is hard. It is hard. I wish every kid has a different temperament, and you guys know kind of what can do and what's not. There are issues I want to go to my pediatrician about my kid about, and I know what would work better because I know my kid best. I can give you guidelines. Always reward when he lets you do it. Be very positive with that, and try to pick the struggles that you're going to have. But other than that, those are tough issues to deal with.
Question?
Yes.
I have a 2-year-old, and my cousin also has a 2-year-old. They're about 5 months apart. But is it normal for her to refuse to play with kids her age? I live at home with my parents because her dad is a Marine, so he's not home all the time. But my siblings are between the ages of 18 and 13, and my youngest cousins are 10 and 8. But whenever she's with Shadow, she just refuses to play with her. I've taken her to my school's daycare since I'm in college. She refuses to play with the 2-year-old, and we'll go and look for like the 10-year-olds, 13, 12-year-olds.
I mean, it can be within normal to do that. Again, they more parallel play. They don't want to share, and they know if they're playing with 2-year-olds or they're next to 2-year-olds, they'll have to share things, whereas the 10, 8-year-olds won't. If that continues on into 3 and 4, that would be a little bit different. But it's not an expectation for a 2-year-old to engage other 2-year-olds or want to be. So yes, that can be okay. Okay, I guess one quick one.
You mentioned the discipline book.
Yes.
And that mentions the timeout. Where do I get it?
So you can get it at any children's physician's office.
Okay.
They all have it. Okay. Like I said, I hand it out in my office quite often. It's very good. So, great. Okay. I had a lot of fun. Thank you so much, guys, for coming. I appreciate it. Okay, I'm in trouble already. I can see myself getting in trouble. Okay. Thanks. Thank you so much. Oh, not a problem. Thank you.